According to the American Cancer Society, breast cancer is the most common cancer for Black women in the U.S. They are also 42% more likely to die from the disease than white women. New research looks at one possible reason for the disparity.
Josie Barrow never imagined she'd be standing in thigh-high water learning to fly fish.
I didn't even know what it was.
Nor did she think she'd be any good at it her first time out. But
I caught 2 fish. I was fighting with them.
But what Josie said she did expect, unfortunately, was a breast cancer diagnosis at some point during her adult life.
My mom died of breast cancer when she was 46. I was 21.
Melissa Davis is an expert in genetics, developmental biology, and cancer disparities.
Whether or not you get breast cancer isn't the disparity. The disparity is whether or not you survive it.
Oncologists have recognized for years that African American breast cancer patients tend to be younger and have more aggressive cancers. Davis and colleagues have identified a set of variants in the gene DARC-ACKR1 in women of sub-Saharan West African descent. The research found when breast cancer patients had a lower expression of the gene, their tumors were more aggressive. Davis says this discovery paves the way for the development of targeted therapies.
If we can identify what it is that's driving the proliferation, the aggressiveness, then we can try to block it.
Josie beat back breast cancer twice, first in 2016 and again in 2018. She's active in support groups, which led her to an outdoor retreat with Casting for Recovery, where women can share their journey.
They're not alone out there.
Davis says one aggressive form of cancer, triple-negative breast cancer, is highest in African American women compared to white, Asian, and Hispanic women. While there are some treatments available, Davis says the key is early detection. And that's your Health Watch. I'm Connie Fellman, Local 3 News.